Now that vaccines are rolling off the assembly lines, where are they off to? More developed economies are at the front of the line. Some countries are starting to vaccinate the super-rich or celebrities, like here in Indonesia, where the government inoculated Instagram influencers. The World Health Organization is calling foul.
It's not right that younger, healthier adults in rich countries are vaccinated before health workers and older people in poorer countries.
It's a problem many saw coming. So is it too late for equality in the largest vaccine drive in world history?
Well, check this out. The news organisation Vice has discovered the wealthy are paying big bucks for specially organised vaccine holidays. At a time of travel bans, they take a luxury trip to India or the Emirates, long enough to get their 2 jabs and fit in some sightseeing. Critics say using their money to jump the queue ahead of the more vulnerable is unacceptable. Campaigner Nick Dearden says research shows many more people will die if the rich get the vaccine first instead of doing it fairly. We'll talk to him in a moment. First, healthcare workers in Kenya fear for their lives. The vaccine hasn't arrived yet, and COVID is taking out their colleagues one by one.
Dorcas Mogore loves her job as clinical officer. A big part of it, though, was to work closely with COVID-19 patients. Then one day, she got sick herself.
I survived COVID. I went through a lot of problems. After I was infected, I didn't have a medical cover which could cover my bills, and I got so sick. I was supposed to go on oxygen. Both of my sons were infected too. It was very traumatizing.
She survived. 9 of her colleagues did not. And then another shock. She had to pay the expensive hospital bill from her own pocket. For over a month now, she's been on strike. With her, nurses and medical lab officers, more than 30,000 healthcare workers, according to the unions. Their demands include protective gear, health insurance, and compensation for families in case of death.
If any of us is to die from coronavirus today, their family is going to live in destitution. And as if that is not enough, then they tell you if you do not go back to that unsafe working environment, we are going to sack you.
Indeed, healthcare workers across Kenya have lost their jobs for participating in strikes the government says are illegal.
Nobody is denying that you should be getting your money. You should. It's a legitimate right. But we are also saying that when there is this situation in the country, let's also face it together, and don't make it look like you are blackmailing the government at its weakest point.
As Dorcas doesn't feel protected by her employer, she's awaiting the COVID-19 vaccine. Kenya expects to receive the vaccine through the COVAX facility, among other sources. But experts say a 60% vaccination target is needed to achieve herd immunity on the African continent. Meanwhile, wealthy nations have reserved more than half of the vaccines, even though they're home to only 14% of the world's population.
So there is kind of some selfishness to say, let us first reserve enough for our people. I think the issue here is that global responsibility issue. So you can reserve as many as you want for your country, but what is your responsibility to ensuring the world is safe?
To be safe, that's also Dorcas' wish for herself and her colleagues.
How do you feel about that, that Kenya and other African countries get the vaccination later?
Yeah, we feel like we are less human. We feel like we are not considered. But anyway, better late than never. At least we are hopeful we are going to get the vaccination.
Kenya's first tranche of 24 million vaccine doses is expected to arrive next month. Dorcas now hopes the vaccine will finally ensure her safety.
Well, hopes are higher elsewhere, leading some to accuse countries of hoarding. We'll get to that in a moment. Firstly, though, let's look at some of the numbers because, funnily enough, the welcoming and oh-so-tolerant Canadians are first in line, having secured the most vaccines per capita. The US, as we mentioned, it's organised over 7 doses per head. The EU, at least 4. India, 1.5. Indonesia, just 1 per person. And the COVAX scheme, as you can see there, to share out shots is sadly struggling. Nick Dearden is Director of Global Justice now and joins us from London. Nick, you've been campaigning for global economic justice for over 20 years. Where's the justice in this case?
Well, it's a really good question because, we're so impressed with the scientific ingenuity that has brought us these vaccines. But unfortunately, most of the world are locked out of access to the immunization that we also desperately need. They've been hoarded by rich countries, and the patents, the monopolies on these vaccines are held by some absolutely enormous businesses for the next 20 years, which just makes it so much more difficult to produce the numbers that we need.
It makes it so much more difficult for those of us who don't want to get the coronavirus because, if you're going to immunize or vaccinate only half the world, it's not going to solve this problem, is it?
Well, that's exactly right. I mean, we're already seeing at the moment mutant strains. Of course, one of them's come from my own country, but there's one from, now we believe, from South Africa, one from Brazil. The longer you allow this virus to run unchecked in other parts of the world, the more mutant varieties of it will come back and hound us. So, I mean, on the one hand, it's just simply unfair, of course. I mean, nobody in Europe would consider only vaccinating the richest part of their population and keeping the rest of us in lockdown. Yet we're perfectly happy to do that on a global basis, or at least our governments are. And I believe that's not ethical, not right. But I mean, even if you just look at it purely selfishly, unless we reduce the virus is spread everywhere, it's going to come back and rebound on us, potentially in varieties which are immune to the vaccine.
And we knew there was going to be this injustice. That's why this COVAX system was set up. But what happened to that?
That's right. And the COVAX system has bought vaccines for lower income countries. It will begin distributing those vaccines soon, but it hasn't got enough money to buy all the vaccines it needs. And frankly, even if it did have the money, the vaccines just simply don't exist at the moment. So COVAX was invented for a great reason. It was understood that if we gave this vaccine out in proportion to those who need it the most, so fairly around the world at the same time, that's the way you're going to save most lives. You're going to immunize those who are most at risk, and it could save millions of lives compared to only allowing the rich to immunize their own populations first. So it's a great idea. The problem is that many rich countries like my own decided that they were going to jump the queue and simply buy millions and millions of vaccines themselves so that there wouldn't be enough left on the market.
Why didn't they line up?
Why
can't the Brits line up orderly like the Germans do?
It's a good question. We've seen that a lot over the last few years, but absolutely. I mean, they just decided they wanted to vaccinate the whole British population first, and I think seemed pretty immune to the questions of global injustice. It's not that they haven't given any money to COVAX. They've given quite a lot to COVAX, actually. I think one of the problems with the British government particularly is it always stands behind the pharmaceutical industry, some of the companies of which are based here, and regularly puts the returns that those companies make before the needs of the population globally. So at the moment, Britain has...
Nick, if I can cut in, we only have a few seconds. How do we solve this then? Is it a case of governments having to take over those patents from private pharma?
Precisely. And let's bear in mind, many of these vaccines have been produced with public money. Some have been produced entirely with public money. So the idea that you then privatize that knowledge and allow those companies to make profit off it in coming years is just completely wrong. This is a pandemic. It's about people's health, not about return to shareholders. So the government should keep the patents, share the technology, and help countries around the world produce the manufacturing capability so that they can produce the amount necessary to end this virus.
Nick Dearden, Global Justice Now, thank you very much.
It's a pleasure.
And it's that part of the show where our science correspondent Derek Williams takes the reins and answers your questions on the coronavirus.
What makes the new UK variant of the coronavirus more contagious?
Viruses evolve over time, collecting genetic changes called mutations. Most of these changes don't make them more effective in some way than their forebears, but every once in a while, through sheer chance, a variant like the one discovered in Britain will acquire changes that give it advantages. In this case, they appear to have made it more transmissible. So it's able to infect more people. To find out exactly what's going on at the molecular level, scientists first had to look at exactly where changes occurred in the variant's genome that made it different from earlier versions of SARS-CoV-2. Then they had to try to figure out how those genetic changes translated into changes in variant protein structures that could explain why people who get it are more contagious. To enter cells, SARS-CoV-2 uses a structure called the spike protein. Those are those bits that stick out all over the surface of a coronavirus. That's what it uses to latch onto specific receptors on a cell's surface as it seeks to break in to make more of itself. In the new variant, investigators discovered 17 quite recent mutations, and 8 of them affect the spike. They change its molecular shape in different ways, and it's likely that at least some of those changes make the variant better at latching on to receptors. If the spike fits the receptor more snugly, the hypothesis goes, it's probably better at infecting the cell, possibly a lot better. For reasons that are less clear, some of the mutations might also drive up viral loads in the throats and noses of people who are infected. So when they speak or cough, they spread more of the virus to others. Those two aspects, the experts say, likely explain, at least to some extent, why the new variant is more transmissible.